We're at the American Academy of Orthopedic Surgeons annual meeting here in San Diego, which is where I practice. It's our biggest meeting of the year for the entire specialty. I subscribe to the philosophies when you're doing a knee replacement, you want to make it a little bit more personalized. Try to make the implants match the patient's native anatomy, not try to push them into anatomy that their knee was not ever designed to be in. So as you're trying to, push the alignment of the implants more toward a patient-specific target, if you use conventional old school instruments, the chance that you make an error is higher. And with big push in recent years toward robotics, you're going to use that same vendor's implants, and that's a pretty big investment to bring into your hospital. Ortholine is a navigation company for total joint replacement, for total knees, and now for total hips as well. It really helps put somebody's knee specifically where their alignment is. The Ortholine basically comes like an iPhone. It's mobile, it's portable, you can take it to whichever hospital you want to take it to. More recently, they've introduced this Lantern balance device. It senses the level of distraction that you create when you put it in the patient's knee, and then it gives you objective numbers right there on the screen, and it's all in the surgeon's hand. You actually can touch the screen and advance through the surgery. For me, it's just a lot more user-friendly. I've used robotics before, and with robotics, you're usually talking to the rep in the room. There's a camera that's sort of communicating with the robot. This is all right here in your hand, so it's very simple to use, and you can use it with any implant. It's sterile. You can take it to an outpatient center or whichever hospital setting. I've done overseas work. You could put this on the plane with you, take it over there. You can't do that with a robot, obviously. I think it's going to continue to evolve, and I think with a product like Ortholine, being user-friendly, being nimble, being accessible for whoever wants to use it, that's to me one of the biggest advantages of Ortholine.